Ruben. Fire away. Today to Dr. Ruben Kannan. Dr. Kannan is a plastic surgeon at the Dr. Chambers Aesthetic Clinic in the UK. Hi, Dr. Kannan. How are you?
Thank you, Joanne. I'm fine. Thank you.
Great. Dr. Kannan, let's talk today about eyebrow lifts. What is an eyebrow lift?
An eyebrow lift is a procedure, surgical or non-surgical, where we lift the brow up into a higher position. Now, when again it's trying to create a youthful appearance for yourself. Now, in a lady, the brow is about 1 centimeter above the bony ridge that you can feel over here, and it's got a particular arch to it. In a man, the brow sits pretty much at the end of the bony ridge that you can feel there. What happens with time is that, again, with laxity of skin and time, the brow drops. And as it drops, everything sort of sinks and falls into the upper eyelid. And that can make you feel tired. That also gives an appearance of you feeling old, because everything just cramps up around the eye. It's a bit like a curtain dropping onto your eye, so it makes you look older. Now, what we do in a brow lift is to lift it up to the original position or to a better position, so that functionally, it doesn't impede your vision. For some people, it makes them look brighter and less tired. Also, it has this particular, I suppose, sequelae of aging, also has the effect of causing headaches, because sometimes, as it drops too far, the forehead muscles keep on trying to lift it. If you can try and imagine somebody trying to hold the eyebrow up with the muscle, and that can cause headaches in some people as well. So this can either be done chemically or surgically. Chemical brow lifts can be done through the injection of Botox. So Botox can weaken the muscles which pull the brow down, and therefore have a temporary effect of lifting the eyebrow out, making you look younger, fresher, and it makes a difference. Now, in some patients, however, Botox is beyond it, and you need to do it surgically. There are different ways of doing it surgically. We can either do it endoscopically through a keyhole, but that depends on your facial structure. But most instances, what we do is we either go through incisions in the hairline over here, or incisions through the eyelid, upper eyelid, so we can hide the crease and then lift the eyebrow up. And there are different ways of doing it, which is, I think, quite technical. But essentially, we lift the eyebrow up into a better position to make you look brighter and younger.
What should people know about the possible risks to these procedures?
Well, with the eyebrow lift, particularly if you're doing it surgically, there is a risk that we could damage the nerve supplying the forehead here. That's a common problem. Asymmetry is the other, so you might feel that one brow is lifted more than the other. But I think by far, with brow lift, you can sometimes lift it too high, and some patients find it difficult to close their eyes. So that's the other complication, that your eyebrow is lifted too high and that you have an inability to close the eye. But of course, this is very rare, and it's probably due to a technical error in most instances. But I think that's the key thing. Now, slightly digressing away from brow lifts, there are conditions where in some patients, in some people, we notice there's excess skin or baggy upper eyelids. Now, in these patients, normally we remove the skin. But in patients who have both excess upper eyelids and a dropped brow, simply removing the skin without addressing the brow can cause problems, because when the brow is actually lifted up into a better position, you have an inability to close the eye, and that's potentially dangerous. So that's the other thing about a brow lift. If someone offers you an upper lid blepharoplasty, which is excision of skin from the upper eyelid, you have to be aware that you make sure that the brow is actually in its right place, because otherwise it can give a fallacy, causing droopiness of the upper eyelid, and it's not exactly addressing the root problem. And that's one thing as patients you have to be cautious about.
Dr. Kannan, just to end off, the surgery for the eyebrow lifts, is it permanent? How long will the effects last?
They are meant to last as long as possible. Now, essentially what we do is we lift the brow up into a better position, but it has to stay there. And how long it stays there depends on a patient-to-patient basis, on the individual. Some patients have droopy skin, so it may recur again. And some patients don't. They have good skin tone, they look after the skin well, it stays where it's supposed to be. So that's variable. That's variable. But I suppose there is an effect, depending on the type of technique that you use. The essential thing is that the closer the sutures are to the brow, when you fix them, the more likely they are to stay there longer. Whereas stitches which remove them higher up, for example, there are threaded lifts called silhouette lifts, which are so-called threaded or barbed threads. Those effects don't last as long. They probably last up to a year. Because if you're trying to pull something up, eventually the weight of that will also pull it down and bear it down. So the effects are not as effective. So if you're having a brow lift, the most effective one is one which stitches the brow essentially to the muscle over there and it sticks better. Those tend to last longer.
Thank you. Thank you so much for talking to me today.
You're welcome.